Okay. Welcome to the Holistic Equine Academy of Lymphedema. I'm Teresa Mueller, and this evening we're going to be going over the basic professional curriculum. What does it really mean? And we came up with one more, and we'll talk about one more webinar, and that will be this Thursday,
Okay.
7:30, 8:30, and I'll tell you a little bit about it at the end. So we'll get started. So this is not what most people don't realize. This is not just another massage modality when we do manual lymph drainage. Here's the difference. We are working an entire system. We're working the lymphatic system. So, that's very different when you do traditional massage. You're working the whole body, but we're working a very specific piece of that. And that's why this becomes so important because you're just not doing a modality. It's a modality and you're managing the entire system, lymphatic system of the horse. That's very dynamic. And it gives us the opportunity to see through different lenses when we start doing all of our see, touch, and assess and our grooming technique. So, what we're going to be doing tonight, we're going to be reviewing the 6 week journey, why qualified equine lymphatic therapists matter, and they do. And we're going to give you a basic professional curriculum invitation, and we'll talk about that later on. Okay, so we're going to go to the next one. Okay, so before we talk about the curriculum, we need to take a few weeks and step back. Tonight is really bridging all the awareness. Now we're going to put that awareness into action like a verb. Let's go. Let me see if I can get this higher. So we started out with the hidden impacts, right? Then we went on to understand the connective tissue. We talked about the hair direction. This should be grooming technique because that's all encompassing of it. MLD, therapists, and last week we did owners. So the message every week is when you change the way you see the horse, you change the way you help the horse. And I think that's very, very, very true. So what we did is for the last 6 weeks, we moved from as a therapist, what am I missing? To actually think about this. What system have I not been trained to evaluate? That's a whole different aspect. I'm going to ask your feedback on that. What do you think? You went through the last 6 weeks. You give me some feedback.
I was wondering how this relates to like acupressure or acupuncture because they deal with connective tissues
Right.
and the fluid, like the lymph fluid. So I just don't know. I was just wondering if,
Well, I know that some people have used acupuncture and acupressure to reduce swelling in the legs. That I know. What's interesting is when they did the acupuncture on horses who couldn't sweat, it didn't work. And I was really surprised at that. I'm like, that doesn't make much sense to me because it stimulates the connective tissue. And I know that other people have used genie acupuncture to help reduce the swelling. They do it in humans.
Mhm.
So I'm not sure. I was really, really quite taken back by that when I read that. And I had to read it. I said, am I really reading this correctly? There was a woman down in Georgia that did a paper on sweating and how they actually monitor it and how they calculate it and that kind of a thing. And she said that one of the things was that acupuncture was not effective in allowing them to sweat, and something just doesn't sit right with me. I'm surprised at that quite a bit. So I don't know what the study was. I don't know. I couldn't answer that, but that's what the feedback was.
I
And I'm
see.
I'm perplexed, to be honest with you. I really am, because I think acupuncture is excellent. Have you had it?
Yeah. Well, I've had acupuncture on me, but I was thinking maybe like acupressure, where you actually, do you touch the point could be a better, modality for that. Because then you're actually feeling the horse, whereas the needle,
Well,
you
you
just,
could, yeah, that could possibly be. I can't, that's a
I
really
know.
good point. I don't have it because I'm not an expert in that, in acupressure. The person who would answer that would be Tracy Vroom because she teaches that. And
Okay.
that's out of
Yeah,
my scope.
thank you.
You're welcome. How about you, Carrie?
What was the question again? I'm
No,
sorry.
I'm saying here is what we started out, we were saying, a lot of people will say when they, what am I missing? What am I missing? And when you go through the 6 weeks, it's not so much what you're missing, it is what system you're not trained in or
Well, you're
evaluated.
not really trained in the lymphatic system. You're just told that the blood dumps the waste out of your blood system and your tissues into your lymphatic system, and then you urinate it out. I mean, you know, I took nursing for a little while, and we really that was about it.
Yeah, I know. I've been through that with recently with several nurses. Um, about we had a discussion about it. But anyway, I'm talking about the mindset. When we a lot of people start out, they say, I'm missing something. I feel like I'm missing something. And it's not so much that you're missing something, you're missing a system. That's the
Yeah,
difference. That's
I
where
tried everything with Grace, and I kept missing and missing, and I was at my wit's end, and then I found you.
Well, that's what I'm telling you. It's a system. How many
Yeah,
people work a system? Think about
yeah,
this for a minute. That's
very
what
little.
that's what I'm telling you. So it's a totally different mindset. Donna, you want to give some, some feedback here?
Well, I know in the week where we discussed the hair direction, you were saying to, follow the direction of the hair and to find out where the problem is and that it could answer questions. So, not being familiar with this and not being an equine body worker, anything, I could see, how you proved your point. I could see what you were saying about it.
Yeah, but people say I'm missing something. I need a new modality. I need a new skill. That's one mindset. What happens when you say I need to work the entire system? Everything shifts. That's what I'm telling you. That's all this is. All right. So So what we need, the industry doesn't need more guessing. So what we need is qualified professionals who can recognize the lymphatic cues,
Yes.
explain what they're seeing, and work within a credible scope of practice. And that's important that we stay within our scope of practice because here's what you gals proved last week. Owners need answers. You got Jeannie, you got Carrie on the call. What do you need? You need answers,
Yeah.
right? That's what you were looking for. All right. So you got reoccurring swelling or chronic discomfort, and you've got these mystery patterns like what happened to Stetson. He just blew up. Nobody knew what it was, and it was lymphatic congestion. So, and the professionals need a lens. Massage and body work is very valuable, but the lymphatic congestion requires a system specific way to evaluate it. There's a mind shift change right there. Because other people say, well, I'm doing manual lymph drainage. And when you ask them, are you working a system? They were like, huh?
Mhm.
They don't even know what they're doing. They
I,
don't
I,
have
I,
that background.
I think I kind of understand what you're asking, the system. So if you're a massage therapist, the system are the muscles. If you're a chiropractor, it's the skeleton. Is
Right.
that what? And
But yeah,
so,
right. You see that's exactly my point. So as a massage therapist, what are you doing? You're looking at all these other muscle tendons, injury, all that kind of thing. But we're working an entire system that people don't even acknowledge. That is incredible.
We
That's
need problem solvers.
well, that we're going to get to that. So this is why the profession matters. It matters. It turns the signs into an informed action because when you see them, then you know. So first thing that we do, the lymphatic therapists protect the promise of their work. The value isn't knowing the strokes. The value is understanding the system, the sequence, and the boundaries and the responsibilities that we have. So the first thing we want to do is look at the anatomy. You want to understand the basic because when you come to a problem like Stetson or a problem like Walter, I don't think I mentioned Walter to you. A couple of years ago, I went down in North Carolina. A horse was bucking blind. The owner would get on him and he would do his, they were doing horse shows and all of a sudden he would go bucking blind. They had three or four vets there, this and that, every test. And so I went out there and I said, I don't know what it is, but I know it's a nerve. It's something he's hitting a nerve because you could see in the video that the horse was in pain. It was a nerve reaction. It wasn't say, "Hey, I think I'm going to buck today." You know, that's wasn't what it was. So I went home and I thought about it, and something told me to go Google something about the fascia, and there it came up: equine myofascia pain syndrome. He had almost every single symptom in there. And that's how we identified it. So sometimes what I always say, knowing the anatomy is going to bring you back to the basics. And I want to talk about that in a little bit. Then we want to make sure we apply the right technique. The grooming, you can go either way. With MLD, MLD, you go one way and it's slow. Grooming, you can go fast, you can go slow. They're apples and oranges in certain ways. They both drain, but manual lymph drainage gives the therapist the ability to reroute it to an area that's not congested. So that makes it very important. And then we know what not to treat. So we got some um, contraindications, and we want to make sure that we partner with the veterinarians because a lot of them, even when I put Tom down in June, and she says, "You sure you want to put him down?" And I said, "Look, I did the C-touch and assess on him. He's filling up from the rear to the front. He had outstanding lymphatic fluid, flexibility in his front legs. And the congestion was moving from the rear to the front. And I'm like, no, this isn't gonna work. But she didn't even understand what I was talking about. And I'm going, they're going this and they're doing this, and she was like, okay, whatever, Teresa. So, but my point here is we need to really partner with them, and what we need is really credibility. So the modality we want to make sure we are educated enough, have boundaries, and we have qualified practitioners. So that's part of what we're doing here. So the problem is it not effort because we have many equine professionals are already giving everything they have, and they do, but they have reoccurring swelling, discomfort, or mystery cases like with Stetson. This is Stetson when he was blown up. And you say, what did I miss? Well, you didn't miss that. What you missed was the system. And they never ever trained anybody to evaluate that first. So this is why this makes it exciting. It also is like, a double-edged sword because when you say that to people, they're like, whoa, I don't know about that. The vets, I mean, what do you mean the vets don't know? Well, they don't know because if you're not trained, you don't know what you don't know. It's
Right.
that simple. So, and I'll give you an example. You know that my husband has got cardiac issues. So the cardiac nurse came. She's excellent. And I don't know how the subject came up, but it did about the swelling, about swelling. And I said to her, Ariana, well, let me ask you this. What is the swelling that occurs when somebody has congestive heart failure? Oh, well, that's because it's the fluid is backing up. I said, what's the fluid? Dead silence. I said, what system is not working when that fluid builds up? Oh, it's the respiratory. I said, no, it's a lymphatic. So I educated her. She goes, Teresa, we were never taught this. And this is a person who is a very highly skilled individual, highly, highly skilled. So if it's not taught, you can't, how can you blame them? They don't have the information. She didn't
Right.
realize that it was the lymphatic system and the lymph fluid that was really what was backing up in congestive heart failure. So it's an awareness issue. So that becomes real important. So then we have here, and you hit the nail on the head, Jeannie, the core difference. We see muscles versus lymphatic lenses. So most modalities will start when I'm looking for tension, I'm looking for mobility, soreness, performance, but we start beneath the surface. So we're looking at all that, all the loose connective tissue, the flow. We're looking for congestion clues, fluid movement, and we can make better decisions. It's not more pressure. It's a different system because you can do deep tissue. People come in all the time and just, well, they want deep tissue. They don't even know what deep tissue is. And I'm just going to give you a hint. If you do get a massage, do not order deep tissue. You are wasting your money. Deep tissue is used for people who've got a particular medical condition, whether it's a rotator cuff or their SI joint or whatever it is, and you're going to work that. And that's where you're going to give it. If you give everybody deep tissue for the entire body, you're getting, some people get down to the bone. These people spend 3 or 4 days trying to recuperate from the pain and the discomfort that causes. You should not have pain when you do massage. All right. So I'm just telling you, it's a marketing issue. I don't want to get into it, but don't order deep tissue. All right. So you got traditional equine massage. What do we work on? Jeannie hit it. Muscles, fascia, range of motion, relaxation, performance, right? But nobody's ever looking at the lymphatic system and the congestion and how all this congestion impacts relaxation, performance, range of motion. And that's what happened with Stenson. Um, his legs were collapsing up in front. Why? There was so much pressure in the tarsal, I mean carpals there from the fluid. He couldn't hold his weight up. I think it was impacting his apparatus, his standing apparatus, what makes him stand up. He couldn't hold his weight. And we got the fascia and we have the muscles. So it's different. We are managing congestion and moving fluid with where most body workers are more interested in the muscles. All right, tendons, ligaments. Does that make sense to you folks?
Yes.
Good. So we also teach you a very repeatable way to read the horse. So our program does the see, touch, and assess. So we look at hair direction, we look at the tissue changes. When you touch it, you know whether or not it's either flowing, resistance, or restricted. And we're able to make better decisions on how to manage the horse. So that, as mentioned before, the hair direction isn't random. It's a part, it's just telling you that you want to move when you look at the hair direction, and you don't have to know all the nodes, okay? Just follow the hair. That's what I'm telling you. Follow the direction on the horse's hair, and you'll get to the node. Okay. Oh, so this is a curriculum pathway, not a one-off technique. So the basic level builds competency in sequence. So the students understand why the technique matters and before they perform it. So you want to understand the connective tissue because when you understand this, what's going on in here, when you do the grooming and the see, touch, and assess, everything begins to click. Now you realize how much meaning this really has under here when you start doing the see, touch, and assess. And when you can feel the restriction, when you can feel the how fluid is the lymphatic system is moving, or if it's resistant. And then we do manual lymph drainage sequences for the head, front, and hindquarters. There are specific times maybe you only want to do the head or the front limb or the hindquarters. When you do the hindquarters, you need to do the whole body. So that's why the curriculum builds on the foundation here. And let me tell you, and as a practitioner, let me see what this is going to be in the next slide. Okay. Here's my point here. This basic understanding is critical. And the reason that this is so critical that we understand the connective tissue, the grooming, and the manual lymph drainage is because we're actually, as mentioned before, we're doing the whole body. It's a system that we are managing, just not a muscle or a tendon. So the other thing is this. The one thing that I am really big on is this will push a good practitioner to use your critical thinking skills. And here's what I mean by that. We can go back to Stetson. What I say that, or even Grace or Skibo. And here's my point. When somebody comes up with a problem, like I don't know what to do, the horse is lymphatically congested, go back to your basic fundamentals and go over them. What is happening underneath the skin? And I would tell you almost 9 times out of 10, you're going to find the answer. The problem is that we live in a very high-tech world. You want to do AI, you want a quick answer, you go on Google and you get it. We're not thinking through. That's why Stetson had 19 professionals and nobody knew what it was. We're not using the critical thinking skills, saying, okay, this horse, and you don't even have to have a diagnosis. Just look at the symptoms of what they're giving. Go back into the basic fundamentals of the connective tissue, what it does, why it happens, what the flow looks like. And I believe that you're going to find your answers. I've done it numerous times, over and over again. I mentioned earlier about a horse named Walter. They flew me down there to North Carolina to look at this quarter horse. And he and he's the one that was they would be at a competition and he would go bucking blind. And I said, I don't know what's wrong with him. And I told you, I went home and I thought about it. About 6 weeks later, boom, I said, I keep thinking about Walter. I feel I know the answer, but how come I don't know it? I know the answer, but I can't retrieve it. And there it was in my brain. And I I was Googling something fascia or whatever, and this came up. And I was like, wow, there it was. What did I do? I had to go back into my hard drive and think about what was going on with Walter. Why was he having those problems? And since then, he hasn't had any problems with the bucking. We worked it out. So she's a therapist. She knows exactly where his points are, and she takes care of it. And the problem has resided. Unbelievable. So you go back to the basics, to the fundamentals, to look at something to say, how is this, whatever this condition is, whether you know what it is or you don't know what it is, go back and look and follow the process. You know why? Because the answer is almost always there. That's critical thinking skills. Any comments? Nope. Okay. So we got manual lymph drainage. Lighter is not less. In my opinion, it's more. You're working a different system. This is Lorna. She's excellent. She goes so slow. and it's wonderful. It's slow, it's light, and it's rhythmic, and it stretches the skin and the loose connective tissue into the direction of the nearest nodes. So the goal is to create space, because when we do that, we support the lymphatic movement and assist waste removal and not to overpower the tissues. This is professional judgment is a part of this modality. And that is why I'm really big on this. This is a differentiated program that does not teach you what to do. It teaches you when to do it, why do I do it, and when not to treat. This is important. So MLD is not going to cure any disease, and it's not going to give abscesses, or it's not going to cause laminitis. I've gotten those calls too. Well, the practitioner just did MLD and my horse now has laminitis. No, laminitis is an inflammatory reaction that's taking place underneath the skin, and you have enzymes that are involved, and there's a chemical and metabolic issues that are going on. The practitioner did not do that. Another person said they were upset because the horse had an abscess. I said, you should bless her, because now she moved it to the point where it can exit the hoof and heal. So that is what it doesn't cure any disease. What we do is mentioned, clear the pathway, and the body will take care of itself. Just yesterday, I met a friend of mine. We do it every month or every 6 weeks. We eat for breakfast, and we were talking about Chinese medicine. And she had this old book, and I said, "Oh, Cindy, I got to get this." And they in that old book, they were saying 80%, somewhere about 80% of what's out there the body can handle. Can you believe that? I've heard that about humans. The
Yep.
body will self-correct almost 80% of what we're dealing with. That's amazing.
Yeah.
Yep.
Well, I think if I feel like the lymphatic drainage and the grooming doesn't cure, but it sets the body up to
Yes.
heal like whatever like the even the medication, it'll open up and or drain to the lymph node. And so when, the veterinarian comes, then it's set up for them to work on them. They'll have better,
I
uh,
think that absolutely, because it's not congested, Jeannie. Because remember,
yeah,
you're clearing the highway of debris,
yeah,
and every cell has to go through that highway. And if it's clear and it's sealed and it's free to move, it
mhm,
goes on its way. What happens when it congested? It gets stuck. Some of the cells die. Some things mutate. What happens to this? What happens to that? So I really think that's the best thing that we could do is give them a you
mhm,
know, lymphatic massage, because all we're doing is clearing the pathways and we're setting the body up to restore itself. That's exactly what we're doing. The body will self correct itself. And when it doesn't, then we can step in, give it a chance, and give your
Right.
body that same chance too.
Mhm.
mhm.
So we're not making a miracle claim. We're actually putting together a professional framework here. So confidence comes from knowing the system. And you know what I tell people who go through this program? Take your toughest cases. When you do your grooming homework assignment, you go out and get the toughest cases, because they're going to teach you more than I could ever give you. Because that horse is going to tell you right on the spot what's happening, and you're going to see it real time. What better way to learn something and remember it? Think about that. So okay, so now we got here. What do the students gain? They gain a professional capability. The outcome is not simply I learned a technique, is I know how to look at the horse differently. You can go back, you understand congestion. You can understand how the connective tissue. You explain why things are happening and what you feel. And then you can actually apply these specialized, whether it's the see, touch, and assess, the grooming, or MLD. And what's really wonderful is we get to educate all the owners, the veterinarians, and other equine professionals. So there's a difference between adding another service. and developing a very distinct professional lens. It's very different. Like I said in the beginning, you're not just doing a modality, you're managing an entire system. That is awesome. Think about this. You're dealing waste, it manages the immune system, and it also helps manage the fluid balance. That is tremendous. You think of pleurisy, you think of congestive heart failure, you think of like even laminitis, that is an inflammatory reaction. So when inflammation occurs, the blood circulation slows down. When blood slows down, the lymphatic system builds back up. So
Right.
anytime, what I think I want to do is, I'm thinking I'm going to think I'm doing a class on what are the key words that would help you identify lymphatic congestion.
Swelling,
What was that?
inflammation, and swelling.
Yeah, but I'm talking about other words, like people may not realize, yeah, they can see the swelling, but sometimes you don't see the swelling, Kelly. You could feel it, but you don't always see it. But I figured I'd put together maybe a list of words that for an owner, if they're talking about inflammation or, the ligaments, tendons, it should ring a bell to let you know that the lymphatic system is a part of that system. Who is that?
Sluggish.
Yeah. Okay, so your journey doesn't end here, folks. Becoming an equine lymphatic therapist is your next chapter. So, what we're going to be doing this Thursday, this was just giving you an overview of the journey that we took. This has been an amazing journey for 6 weeks.
Yeah.
We have learned so much. So, what we're going to do on this Thursday, we're going to talk about the actual curriculum and the tuition and how it works. Like, what's in, you know, what are the homework assignments? Why are they important? What do you have to do? We got 2 classes that are online, and the third one has to be in person. So that's what we're going to do. So this Thursday, we're going to talk about that. And anybody who wants to schedule a call with me, you can certainly do it, and we can talk about what's important. So before you choose a program, choose your purpose first. What's your purpose? Think about that. What's your purpose? And I think that really sets it off, because what I like to do with a lot of the practitioners is to talk to them. What's your purpose? What do you want to do with this? Why do you want to do it? Because that helps stimulate ideas for them. I think it gives them hope. I think it gives clarity to maybe what they really want to accomplish. And here's the thing, I don't have all the answers. I'm very upfront about that. So when you go out there, that's why the grooming technique is so important. When you do it and you work on other people's horses, you got to take the worst of the worst. I'm not kidding you, because they're going to teach you the best and the most that you can ever imagine. They're going to activate those critical thinking skills, which will make you an outstanding practitioner. Because I don't know of another modality that works a system. Maybe the somatic system. How the somatics works the nervous system. So, you know, this and there's quite a bit known about the nervous system, but there's not a whole lot of knowledge about the lymphatic system. So that is the journey of possibilities. 6 weeks, and when this culmination that we came tonight, I think it's been pretty incredible. I like your feedback on it. Jeannie, you want to say anything about these last 6 weeks? Uh-oh.
Well, I slowly, I mean, it puts what I've been doing all together. I mean, because before I don't know, I was doing the grooming technique, but my purpose was just prophylactic treatment, not not a, I guess that was my purpose.
It was. For you,
Yeah.
yes, it was.
Yeah. Like a maintenance.
But you realize now, you have a better view of this, wouldn't you
Right.
say?
Hmm. Yeah. And I can see how if when you have the worst of the worst, the the benefits will be dramatic.
Absolutely. And you want
So,
to know, you'll never forget it.
hmm
And you know what it will do? It will re-solidify your anatomy and phys. Think about
yeah,
that. You
yeah.
well, you just like I did with Walter. It took me about 6 weeks, and I figured out, And this, let me tell you real quick about Walter. We were doing. She got really. She's an outstanding equestrian. This woman, Pam, outstanding. And she went into the stall one day to put his halter on, and he turned on her, and she goes, "Teresa, I'm getting nervous." He never did that before. So when he turned his head, she hit a point. His neck tripped a nerve. Instead of bucking, he went to bite her.
Mm,
Okay. And so for her, this was a real eye opener. And, while we were working on Walter, this is God as my witness. I got to tell you this. All of a sudden, along his barrel, it was horizontal. You see all this little bubbles coming up. It was the lymphatic system because the lymphatic system runs parallel and it was going across the barrels. And the more we massaged him, all of a sudden, all the tension that he had was gone. It was crazy. I was like, we were standing there, and it was just an amazing thing to watch this horse transforming right in front of your eyes. Then her husband took him out on the day that I left. I was there like for 2.5 days, and he worked him. He goes, "This horse has never been this flexible. Always had a hard time turning to the right. He was a little stiff. He couldn't get it together. And now he just turns like nothing."
hmm Yeah, that makes sense. Because of
It
the fluid, it restricts movement.
absolutely.
So, and you can't tell what it is because it's inside. So,
And so you see, but it also masks other things. Like, you're thinking,
mhm.
oh, maybe it's a
Right,
tendon issue, when really what it
right.
was, he was just overly congested and the fascia was so tight, he couldn't
Mhm.
move.
Yeah, yeah. And it presses on the nerve too. When the
Mhm.
fascia gets, whatever nerve is near it, it can
Yeah.
press on
Yeah.
it.
So that's
So,
what this was
yeah.
really about. So we're going to do a call
hmm
this Thursday, the 20th, from 7:30 to 8:30. We're just going to go over what is the investment, what is the training process, what are the requirements. And so this way you know. And I will tell this, even though, Jeannie, I know that you're a horse owner, but there are horse owners like yourself that are very advanced that I do take them into the class. Because, if you want to learn, who am I to tell you no? That's wrong. That's wrong.
Thank you.
No, I mean that. I mean,
Yeah.
you're
This
dedicated.
series has given, I was going to say, this series has given me the confidence to tell the vet, I'm going to do this lymphatic grooming. And, I don't care what they think, they can just say, okay, do what you want, but to tell the vet that, and then they will think about it too when they
Absolutely.
hear it.
Absolutely. I think Kate's on the line. Kate, is she there? She was. Kate, no. Donna, do you have anything? You've been quiet.
No, I think that the last 6 or 7 weeks have helped to put things into perspective, learning about how the lymphatic system is affecting the abscess or the laminitis, that the congested lymphatic system is causing that. So that was interesting because I didn't realize that.
See, there's always something to learn. There's always something to learn. Carrie, you have any comments?
My purpose was to help Grace, and you were our saving angel.
I love that horse, Carrie.
Yes, she was very, very good.
She was like Bella. the Clydesdale that I worked on. Very
Yeah.
much so. Very much like her. And some of the horses that you work on are they just impact you. They touch your life in a way that you can't even explain.
Yep.
Okay, does anybody have any questions?
Hi, Teresa. Can you hear me now?
I sure can, Kate. Yeah, how is my girl doing? How's Wilma doing?
She is doing really good. I had sent her to a trainer in April. She spent 90 days there, and I had an osteopath work on her once a month, and her leg has been fabulous until this last week and a half where we've had so much rain and she can't really get out. And I noticed tonight that it's starting to puff up again. So I did the grooming technique tonight, and we'll see how she is tomorrow now that it's starting to dry up a little bit. They pretty much stood in their stalls for 2 days. I mean, they could go out, but they didn't want to go through the mud.
Yeah,
So.
I know. Yeah, I have a Mustang, and it's funny because she lived out in the wild, right? Let me tell you, when it rains, she don't want to be. She's got it made over here, honey. I tell you, she's
Yeah.
funny. Oh no,
Yeah.
she knows where she's fed. She knows where.
Yeah. But no,
Yeah,
I'm really happy with how her leg is holding, especially after that osteopath had worked on her. She had 4 treatments and it's been staying down. So,
good. Well, then you go out there and you do that grooming technique, Kate.
yep.
So, are you going to join us for one of our MLD? I mean, like for one of our, because Kate, I believe you are an equine massage therapist, correct?
Yes.
Okay.
Yes.
I hope you get to join us one time and complete our program because I think you want to tell a little bit of story about Wilma?
Sure. So we got Wilma as a 2-year-old in the fall, and she was born out pretty much out on the range in Kansas. The lady had brought her in right before we got her, and she told us her ankle swells up or stalks up just a little bit when she's here up in the barn area, but if I, turn her out, then it goes down. So we're like, okay. She didn't really know if anything had happened to her. There were no marks. We brought her home, had the vet x-ray it, nothing. And it had just kind of progressively went up and down, up and down. And it's been probably 2 years I came across Teresa and I'm like, all right, we need to do something. So I started the one course. I haven't completed it because life's gotten in the way, but I have periodically been doing the grooming technique on her and different
Good.
things. And I will tell you, the PEMF, the TheraPlate, she hates it unless you have done the grooming technique and opened her up.
No kidding.
Mm-hmm. My other
What?
gelding, you can put him on there on the TheraPlate. He'll stand there for an hour. You put her on it if I haven't done like a grooming technique or, ridden her and got stuff out. She just hates it and she'll walk off within 5 minutes.
All right, that she's telling you she's congested.
Yep.
She's telling you she's feeling the pressure. So what does she do with the PEMF?
She just doesn't stand real well. You can just tell. And she's one when she gets mad or upset, she'll grind her teeth
Oh
and
God.
she'll just start doing that.
All right, she's telling you that's enough. I had enough.
Yep. So I quit and let her, okay, let's go get you uncongested and see what we can do here.
And then how does she act afterwards?
Then she's better with it. Then she can stand it.
Okay, well, there you go.
So, yeah.
This is a new one. Thank you. Did
Yeah.
you hear that, everyone?
Uh-huh.
Yeah,
Mm.
that's good. That's good. I'm really excited. So, Kate, we're going to be doing this call on Thursday. You really want to join it?
Yeah. I'll try to get on.
Yeah, well, it'll be recorded anyway.
Okay. Yep. And I've gotten on this series a couple times, but I haven't followed it all the way through. So I need
Right.
to go back and watch the recordings.
Yeah, well, I send that tomorrow. I'll send out all the recordings with the
Okay.
YouTube on it. You'll get it, and I'll make sure you get it. I'll make sure that you're on the list. Did you
Okay.
sign up for this?
I don't remember if I did or not. I'm thinking
You
I
must
did
have. You
because,
must have because
yeah,
you're on the call. I'll
yeah.
make sure when I send the recording out tomorrow that I'll check your name on the list.
Okay.
All right, so you can all join us at 7:30 to 8:30 on Thursday evening, and I hope to see you all there. And even if you don't think you're not going to take it, at least you know what, if you understand it and then if you meet somebody, you could explain it to somebody else. Think about that for a minute. So, all right, my dear. Any questions? All right, so we're going to end the call tonight. I will get a hold of Tracy and I will tell her that people are asking about um, the herbalist, what she used. And if not, I know Carrie and I have been working on it. We kind of stopped. Maybe we need to finish that up, Carrie, because she has a list of a lot of herbs that she worked with horses that had lymphatic congestion for Grace. And she has a whole bunch of remedies to help everyone. So I think I'm going to put a call together. You may be seeing it coming shortly. I've got more on my plate than I can handle because I'm having a lot of fun with this. This is really a lot of fun, and to talk to everybody from all over the country. So anyway, I'm going to let everybody go. Any other last comments about these last 6 weeks? Anyone? Jeannie? I don't know if she's there.
Thank you, Teresa, for doing it.
Oh, my pleasure. I'm going to start redoing it September 1st. I think I have on my calendar. Yep, Tuesday, September 1st. We're going to start redoing this on a regular basis because it's needed. And I'm going to do one for horse owners. So that will be because you have a little bit of different agenda. So anyway, anything else anybody wants to add? Donna?
No, but again, thank you for your time.
Oh, absolutely. Absolutely. All right, ladies, I'm going to end the call. If you have any questions, just let me know. And I'm here. Kate, I'm so glad that you joined us tonight. And actually, when you take the introduction to connective tissue and you get to the part where they talk about womb, that's Kate's horse. And she sent me her blood work and we analyzed the blood work and it was amazing. Right? Remember that, Kate? That was a real eye opener. So it was so good that I put it in the course. All right. So I'm going to say goodnight and thank you. And I hope to see you all on Thursday, the 20th, 7:30 to 8:30.
Thank you,
All right. Have
Teresa.
a good
Thanks,
night.
Teresa.
All right. Bye bye.
Bye bye.
Let me see. We're going to get this. All right.